morning. Please come in and sit down comfortably, and do not feel nervous, because this is a safe place where you can speak openly about any problem you are facing with your health.
Good morning, doctor. Thank you for seeing me today because I have been feeling worried about my health for the past few weeks, and I finally decided that I should come and talk to a professional instead of just guessing what is wrong with me.
I am very glad that you decided to come, because many people ignore their symptoms for a long time, and that can sometimes make small problems become bigger problems. So please, tell me slowly and clearly what you have been experiencing.
For almost 3 weeks now, I have been feeling very tired, even after sleeping for many hours at night. And I also feel a strange pressure in my chest sometimes, especially when I am walking fast or climbing stairs.
I see. And when you feel this pressure in your chest, does it feel like sharp pain, or is it more like heaviness or tightness that makes it hard for you to breathe normally?
It is not exactly sharp pain, but it feels like something heavy is sitting on my chest, and sometimes I feel like I cannot take a full deep breath, which makes me a little scared.
That is understandable, because any feeling in the chest can make a person worried. But do not panic yet, because there are many possible reasons for this feeling, and not all of them are serious heart problems.
I hope it is nothing serious because I have 2 children at home, and I need to be healthy to take care of them and continue working at my job.
Of course, and that is why we will carefully check everything step by step so we can understand what is happening in your body and find the right solution. First, I would like to ask you about your daily life, because sometimes stress, poor sleep, unhealthy food, or lack of exercise can cause tiredness and chest discomfort.
To be honest, doctor, my life has been very stressful lately because I work long hours at an office, and after I return home, I have to cook, help my children with homework, and take care of my elderly mother.
That sounds like a very busy schedule. And when a person is constantly working without enough rest, the body and mind can both become exhausted, which can cause many physical symptoms.
Yes, I often sleep after midnight because I finish my work late, and then I wake up early in the morning to prepare everything for the day, so I usually sleep only 5 or 6 hours.
Adults usually need at least 7 to 8 hours of good quality sleep, and when the body does not get enough rest for many days in a row, it can feel weak and heavy. Can you tell me about your eating habits? Because food also plays an important role in energy levels and heart health.
I usually skip breakfast because I do not have enough time in the morning, and during the day, I often eat fast food or snacks from the office cafeteria.
Skipping breakfast and eating processed food can reduce your energy and also increase stress on your heart and digestive system over time.
I know it is not healthy, but I always feel like I do not have enough time to prepare better meals.
Many people feel that way, but sometimes small changes, like preparing simple food the night before or carrying fruit and nuts to work, can make a big difference. Now I would like to ask about your medical history, because it is important to know if you have any past illnesses, surgeries, or family history of heart disease or diabetes.
I have never had any major surgery, and I do not have diabetes, but my father had high blood pressure and my mother has cholesterol problems.
Family history is important because it can increase your risk for certain conditions, but it does not mean that you will definitely have the same problems. Do you check your blood pressure regularly?
No, doctor, I only check it when I feel unwell, and sometimes it is slightly high, but I never followed it seriously.
It would be better to monitor it regularly because high blood pressure often does not cause clear symptoms in the beginning, but it can slowly damage the heart and blood vessels.
That makes me a little worried, doctor.
It is good to be aware, but do not be afraid because awareness helps us prevent problems instead of facing them later when they are more serious. Do you exercise regularly?
Not really, because I feel too tired after work, and during weekends, I just want to rest.
I understand that feeling, but sometimes light exercise, like walking for 20 or 30 minutes, can actually increase your energy instead of making you more tired.
Really? I always thought exercise would make me more exhausted.
It can feel difficult in the beginning, but regular movement improves blood circulation, strengthens the heart, reduces stress, and helps you sleep better at night. Now I will check your blood pressure, heart rate, and oxygen level. So please relax and sit comfortably while I measure them.
Okay, doctor. I will try to stay calm.
Your blood pressure is slightly higher than normal today, and your heart rate is a little fast, but this can sometimes happen when a person feels anxious during a doctor visit.
Yes, I was feeling nervous before coming here.
That is completely normal, and we will not make conclusions based on one reading only. I would like to suggest some blood tests and maybe an ECG test to check your heart rhythm so we can clearly see what is happening.
Will those tests be painful?
The blood test will involve a small needle, which may feel uncomfortable for a few seconds, and the ECG is completely painless because it only records the electrical activity of your heart.
That sounds okay, doctor. I just want to make sure everything is fine.
That is the right attitude because early testing gives us peace of mind and helps us treat problems quickly if they exist.
Doctor, can stress alone cause chest pressure like this?
Yes, stress and anxiety can cause muscle tension in the chest area and also change breathing patterns, which can create a feeling of tightness or heaviness.
Sometimes when I feel very stressed at work, I notice that my breathing becomes fast and shallow.
That is a common sign of anxiety, and practicing slow, deep breathing can help relax your body and reduce that tight feeling.
I never tried breathing exercises seriously before.
I can teach you a simple technique where you inhale slowly through your nose for 4 seconds, hold your breath for 4 seconds, and then exhale slowly through your mouth for 6 seconds.
That sounds simple, and I think I can try that at home.
Very good. And if you practice it every day, especially before sleeping, it may improve both your breathing and sleep quality.
Thank you, doctor. I already feel a little better just talking about everything.
Sometimes sharing your worries can reduce half of the stress because keeping everything inside can make the body feel heavier.
Welcome back. I have received your test results, and I'm happy to tell you that your ECG looks normal, and there are no serious signs of heart disease at this moment.
That is such a relief to hear, doctor, because I have been worrying every day and imagining the worst possible situation in my mind.
I understand that fear, because when we feel discomfort in the chest, our thoughts can quickly become negative and frightening, but your heart rhythm and structure appear healthy.
Thank you, doctor. But what about my blood test results? Because I am still feeling tired almost every day.
Your blood tests show that your iron level is slightly low, and your vitamin D level is also below the normal range, which can both cause tiredness, weakness, and sometimes even shortness of breath.
So that means I am not seriously ill, but my body is just lacking some important nutrients?
Exactly. And when the body does not receive enough vitamins and minerals, it cannot produce energy efficiently, and that can make even simple daily tasks feel exhausting.
That makes sense, because even climbing the stairs at home feels more difficult than before.
I will prescribe iron supplements and vitamin D tablets for you, and I will also suggest some natural sources like green leafy vegetables, beans, eggs, fish, and spending a little time in sunlight every day.
I think I can manage that, even with my busy schedule.
In addition to that, I strongly recommend that you reduce stress gradually, because stress can increase blood pressure and create muscle tightness in the chest area.
Sometimes I feel like I cannot control my stress because there are too many responsibilities on my shoulders.
I understand that feeling very well, but learning to set small boundaries and asking for help when needed is not a sign of weakness, but a sign of wisdom.
I rarely ask for help because I feel like everything is my responsibility.
When one person tries to carry everything alone for a long time, both the mind and the body start sending warning signals, and your tiredness may be one of those signals.
I never thought about it that way before.
Health is not only about the heart, lungs, or blood, but also about emotional balance and mental peace, because everything in the body is connected.
That is true, because when I feel calm and happy, my body feels lighter.
Exactly. And that is why I suggest that you take at least 20 minutes every day for yourself, even if it is just sitting quietly, walking outside, reading something you enjoy, or practicing deep breathing.
It feels strange to think about taking time just for myself.
Many women feel that way, especially mothers and daughters who care for their families. But self-care is not selfish. It is necessary for long-term health.
I will try to remember that, doctor.
Good. And regarding your blood pressure, I would like you to check it twice a week for the next month and write the numbers in a small notebook so we can monitor any changes.
I can do that, and I will take it seriously this time.
Also, try to walk at least 5 days a week for 30 minutes at a comfortable pace, because regular movement can lower blood pressure and improve your energy level naturally.
I think I can start with short walks after dinner.
That would be perfect, and if possible, avoid heavy meals late at night, because digestion can also affect sleep quality.
Doctor, do you think my condition will improve quickly?
If you follow the advice carefully, take your supplements regularly, eat balanced meals, sleep at least 7 hours, and reduce stress gradually, you should start feeling improvement within 4 to 6 weeks.
That gives me hope, because I really want to feel strong and energetic again.
And you will, because your condition is manageable, and you came early before it became something more serious.
I am very grateful that I decided to come instead of ignoring my symptoms.
That was a wise decision. And remember that listening to your body is one of the most important habits you can develop.
Thank you for explaining everything in such a calm and clear way, because I was very scared when I first came here.
That is completely normal, and my role is not only to treat illness, but also to reduce fear and guide patients toward healthier lifestyles.
I feel much more peaceful now.
I am happy to hear that, and I would like you to come back for a follow-up visit in 1 month so we can check your progress and repeat some tests if necessary.
I will make sure to come back, and I promise I will try to change my habits slowly and carefully.
That is all I ask, because small, consistent changes are more powerful than sudden, extreme changes that do not last long.
Thank you again, doctor, for your patience and understanding.
You're welcome. And please remember that if you ever feel severe chest pain, strong shortness of breath, dizziness, or anything unusual, you should seek medical help immediately.
I understand, and I will not ignore serious symptoms.
Very good. And now you can go home with peace of mind, take care of yourself, and start your journey toward better health step by step.
I will do that, doctor. Thank you for helping me see that my health is something I must protect, not something I should take for granted.
I wish you good health and calm days ahead, and I will see you next month for your follow-up appointment.
See you next month, doctor. Have a good day.
You too. Take care.